From an Indian setting, how exactly can digital healthcare be utilized effectively?
Absolutely. That's a question that's very close to my heart. I believe in the phrase that digital inequity will lead to health inequity. So I think, one of the underlying thesis for this book was how can we make health equitable across the world? And I think right now, just to kind of take a step back, the fact that we have, ubiquitous data, we have unlimited connectivity now with massive processing power, I think we have the opportunity of actually making digital health equitable and health equity also across the world. Now, there are many aspects of things that can serve as barriers, and I think the first thing in India that we really need to do is enhance the awareness, enhance the acceptability, and then obviously enhance the accessibility and affordability of a solution out here. If you look at the availability of smartphones across the country, I think about 75 to 80% of folks in India, adults, have smartphones. So just having smartphones enhances the ability of actually using sensor-based approaches and AI-based approaches and making health equitable across a large section of India. So I think we have certainly the intellectual power that can innovate. And that innovation will lead to low-tech solutions, like we talked, for example, about just voice being a predictor of which patients are going to develop tuberculosis. So develop low-tech solutions that can then be potentially scalable across the country. So I'm very hopeful that, with our intellectual power out here, we can certainly make it.
But India has one of the highest out-of-pocket expenditures when it comes to health. It's reduced from the peak, but nonetheless, it's still high. So in that context, how much do you think digital healthcare could probably help in terms of reducing expenditure?
You'll be amazed, but I think in the next 5 years, the cost of making a diagnosis and putting into play the diagnostic pathway for a disease is going to really become minimal. And I think when that becomes the case, I think the health costs will come down, out-of-pocket costs will come down. I think the issue always will be is the delivery of care is expensive. And I think if we can invest through these digital solutions in wellness and reduce chronic disease that we talked about, then our need for complicated care and specialty care is actually going to get minimized. And I think through these digital strategies, we have an opportunity actually to reduce disease and chronic disease and actually reduce the need for patients to actually seek complicated care.
Would that work in a context of, say, preventive care when it comes to cancer as well?
Absolutely. I think, so at Mass General, we have this new algorithm, for example, which is called Sybil, that looks at low-dose CT and can see patients have pulmonary nodules that are labeled to be normal. But using AI, you can actually predict which of those nodules is going to become cancerous in 1 to 6 years, right? Oftentimes they're labeled as normal. So I think AI-based approaches will help us predict and prevent disease, and I think take away some of that cost from within the system.
Well, the other factor about, maybe artificial intelligence and digitization of healthcare is the data deluge. How do you make sense of the amount of data that you collect? How does artificial intelligence help in that aspect? Is that a challenge?
Right. So that's a really good question again. So there's a lovely saying by Daniel K. Morans that you can have data without information, but you can't have information without data. So it's so important for us to recognize that we need the data, and we need to be able to sift through the data. We need artificial intelligence to help collect the data, to help annotate the data, to help curate the data, to help analyze the data, and then give us the output that we can actually use to implement clinical care. Now, this can occur and has been occurring in smaller, situations, but I think it has to become scalable. And I think the part of the data deluge is to develop AI-based strategies that can help us parse through this data in a less cumbersome way. And I think that's where the whole role of generative AI is going to help us.
Okay. Well, one of the other challenges is, for example, the regulators probably trying to regulate artificial intelligence in healthcare? For example, the US FDA has indicated that they don't have resources needed to preside over technology which is rapidly changing. So how do both those lines work and move in parallel?
It's so important to have the appropriate constraints because you have a lot of bad actors and nefarious activity can potentially happen, especially in the artificial intelligence space. I think, those are good points. I think we have to have regulatory forces, but at the same time, we need to know that the data sets we're using for artificial intelligence are representative of every patient we're actually using them for. So you can develop an algorithm in the US, but you may not be able to use it in India because it's not representative of the population that you're actually using it for. So I think data set generalizability is really important. Beyond that, I think there's so much of importance that needs to be given to transparency, to traceability, to know where the data has actually come from. And then the security and privacy constraints are really important. So I think as much as regulatory constraints can stifle innovation, I think it's important because they have to create the guardrails. Otherwise, this can go beyond control.
Okay. All right. Well, that point is taken. On a larger context, Dr. Singh, are we talking about possibly a person in India or in China or in another country getting treated by a doctor, say, in the US, maybe surgeries being done effectively or virtually? Is that where we're probably heading?
I think much of the change we see are going to be driven by patient expectations, by physician willingness, the combination of the two, and visionary leadership. I think all of those things really are the three pillars of we can bring about change. But I think what you say is absolutely right. I think we have to get out of this mold of living in our silos. There's this whole concept of networkness where you can get care from whomever you want, wherever you are, from whichever doctor, for whatever disease you have. So I can envisage a time, not in the distant future, within the next 5 to 10 years, with the adequate disclaimers that I will be able to see a patient in Thailand where I will have sensor-driven data from that patient that I can actually see objectively. I can have access to that patient's records in Thai that can be translated by generative AI and summarized and sent across to me, and in a live, single, one-way, two-way conversation, using that data, using sensor-driven data, and the potential use of AI also in these situations, I could provide care to that patient. And I can see that happening, not in the too distant future. I think the regulatory issues will eventually be overcome, and I think they will be overcome by patient expectations in the future.
But will digitization and artificial intelligence probably overtake the human touch? Will diagnosis probably just be linked to AI eventually because of just the accuracy and surgeries?
So I think there's always the fear. The more you depend on a technology and the less you use your own cognitive skills, you lose those cognitive skills. There is also the fear that you become so dependent on this black box that it can actually dictate how you actually practice medicine. I think it is incumbent on us as clinicians, as regulatory bodies, as patients, that we have to preserve the human touch. There's a lovely saying by Francis Peabody who says that the secret of the care of the patient lies in caring for the patient. And I think it is so imperative that we actually preserve the human touch. We temper the technology in such a way that the digital pathways we create are a construct that bring together this digital and human touch and really change the paradigm of care in the future.
Okay. All right, Dr. Singh, before we wrap up, since you have given so many examples, leave us with a hypothetical example that if in case there is more penetration of artificial intelligence as well as digitization in healthcare, what would be a possible example of a patient in terms of treatment, say 5 years down the line?
So, I think the power of AI lies in prevention, lies in prediction, and lies in not only forecasting the disease, but averting disease. And I think if we have AI-based approaches that can allow us to individually determine which patients are going to develop diabetes, hypertension, or hyperlipidemia, and we can prevent those conditions, which we know we can. We know they're all preventable. Many of these diseases are lifestyle diseases. I think using sensors and AI-based approaches, along with preventative strategies, you can prevent these diseases from happening, which is called primordial prevention, or you can prevent these diseases from progressing. And if you can prevent these diseases from progressing, you can actually prevent coronary artery disease and heart attacks and sudden cardiac death. So I'm an optimist. I would say that I think I would call myself a hope purveyor, that the possibility of actually preventing disease and sudden cardiac arrests and limiting the incidence where patients need hospitalization will significantly get, I would say, reduced with the use of this technology.
All right, Dr. Singh, it's been a pleasure. Thank you very much for joining in, and looking forward to seeing more developments in digitization and healthcare. Thank you very much.
Thank you for having me. Really appreciate it.